guys, my name is Kamara. Today our topic is how to do malaria rapid test, normally called as RDT. Today I will be explaining about malaria and doing some practicals, how to go about doing malaria rapid test. Before going further, what is malaria? We said malaria is a disease caused by a parasite transferred from one person to another to an infected Anopheles mosquito. And I'll be going to do the practical today and how to go about it. These are the items we need: unused kit for malaria. This is cotton wool, this is pipette, and this is alcohol swab, and this is marker pen. In this case, we already has a sample, so we are not going to clip the patient's finger to take another sample, because in this case we already have a sample. So I'll be taking my gloves. This is unused kit for malaria. But before performing this test, always learn to check the expiry date and the manufacturing date. Then this one was made in 2023, March 18, and it's going to be expired on the 25th of the 3rd month. So always learn to check your test kits for the expiry date. In this case, the sample has already been collected, and I'll open the unused kits. This is the malaria kit, like you can see. This is a round hole for buffer, and this is a square hole for blood, and this is the control line and the test line, and it reads 15 minutes, so you should not read the result above 15, exact 15 minutes. And this is a marker pen. This is normally used in the laboratory for identification. So now I'm going to write the patient's name. We don't use to write it over here because it has a lot of writing on it. So let's say, for example, the patient name is Nancy Kamara. The date, let's say 25 of the 5th month, and the identification number. Let me just say 01 or 05. Why you need to label these kits? Because some patients usually has the same name, so we need to identify these patients. Like I said, the sample is already been collected, so I will apple it. Let me just say for 1 minute. I'm going to use the pipette and take 5 micro of the sample. And I will place the blood at the square where the and this is the buffer. I'm going to use 3 drops of buffer. And set, this is my timer, and set it for 15 minutes. Like I said, 15 minutes is over, so we are now going to read the results. You see? This is the results window. The control line is negative, so that means that the patient is negative. If the control line shows and the test line shows, it's going to be positive. But for this case, the patient is negative. Then There is another way to do the RDT test. You are going to ask the patient which hand is dominant. If the right hand is dominant, or if the left hand is dominant, some patients usually work with right hand. So I'm going to take the left hand and clip. Either you clip the ring finger or the middle finger. So that is where you are going to use the lancet. And after clipping, you don't clip at the top, you clip the patient at the side of the finger. Then you will squeeze out the first blood and wipe it with cotton wool and take the second blood. 5 micron. Please like, comment and share.